Observational studies have suggested that for adults undergoing hip surgery, spinal anesthesia is associated with a lower risk of adverse outcomes, including death, delirium, and major medical complications, than general anesthesia. However, randomized trials comparing the effects of the two techniques on outcomes in the post-hospital period are lacking. In particular, it's not known whether spinal anesthesia improves the ability to walk independently after hip surgery. In this multicenter pragmatic randomized superiority trial, 1,600 adults 50 or older who were scheduled for hip fracture surgery were assigned to receive spinal or general anesthesia. All patients were able to walk independently before their fracture. The primary outcome was the composite of death or inability to walk independently at 60 days after randomization. Independent walking was defined as walking roughly 10 feet, or 3 meters, or walking across a room without help from another person. Using a cane or walker was allowed. The incidence of the primary composite outcome did not differ significantly between the groups. Secondary outcomes included death by day 60, inability to walk independently at day 60, new onset delirium, and time to hospital discharge. Again, these outcomes did not differ significantly according to anesthesia type. The incidence of serious adverse events was similar in the two groups. The authors conclude that in older adults undergoing hip fracture surgery, spinal anesthesia was not superior to general anesthesia for lowering the risk of death or inability to walk independently after hospital discharge, and the rate of postoperative delirium was similar with the two anesthesia types. Full trial results are available at nejm.org.